Hello again, everybody. I am so excited to be joined with someone that I think we all know. It is not every day that an immunologist lands on the cover of Time magazine or jumps on a Zoom with Katy Perry and Orlando Bloom, but Dr. Tony Fauci does. For over 3.5 decades, he has served as the director of the National Institute of Allergy and Infectious Diseases. He is also the incoming chief medical advisor for the Biden administration. And since early spring, Dr. Fauci has embodied the medical wisdom guiding the United States through the pandemic. His honesty and knowledge have been a comfort in these radically uncertain times. Please join me in welcoming Dr. Anthony Fauci. Hi, Dr. Fauci. Thanks so much for joining us today.
Hi, Barbara. Nice to be with you. Thank you for having me with you.
Thank you. Well, as I hope you know, we're also grateful for the calm, cool, and collected way that you've guided us through the pandemic. And I'd love to talk with you about that further. First of all, we've just come out of the holiday season. Can you share more about the state of the pandemic in the United States and around the world? Are we seeing the increased spread many predicted post-holiday travel?
Unhappily, Barbara, that is the case. Unfortunately, you don't like when you make dire predictions and they come true. But we were in a bad place even before the actual holidays came upon us, the pre-Christmas, Christmas, the week between Christmas and New Year's, and then New Year's, which we know just from observing airports and train stations, there was a considerable amount of travel. And as you might expect, there was gathering together with family and friends in congregate settings indoors, obviously because of the weather in most parts of the country. And we went from a very high baseline level of infections to even higher. And as we've seen over the past week and a half or so since the ending of the holiday season, everything seems to be a record, Barbara. We get daily cases that are between 200,000 and 300,000 a day. The other day, we had 4,111 deaths. That's terrible. And then we have record hospitalizations to the point where some regions of the country are really stressed with regard to the health care that they're able to provide for people. For example, in hospitals that have maybe 20 intensive care unit beds, they have 50 intensive care unit requiring patients that are stretching the facilities of the hospital as well as the exhaustion of the staff. So we're in a very difficult situation, and it is getting worse. I hope that as we get towards the end of January, that we'll see a peaking and a turning around, particularly if people hang in there and don't get discouraged by COVID-19 fatigue and let down on their public health measures, because we know every new study that comes out shows that masking, physical distancing, avoiding congregate settings, and washing hands actually works. If we don't do that, it could be even worse than what we're seeing right now.
Absolutely. Thank you for that. It's a very sober picture. You mentioned how crowded many hospitals are. And I'm curious, what is your message to healthcare workers who are showing up every day trying to deal with this virus, who are burnt out, and we're hoping that we would be closer to the finish line?
Well, my message to them is that, we love you, really. I mean, they are the heroes and the heroines of this challenge that we're all facing. They are doing things that are almost unimaginable with regard to hanging in there and sucking it up and being stressed both physically and psychologically. But the other message is that help is on the way. So please hang in there. We have already 2 and soon likely, and I hope 3 and more highly efficacious vaccines. The Moderna product and the Pfizer product are 94 to 95% efficacious. We've got to get as many people vaccinated as we possibly can, as quickly as we possibly can. When we do, and as I've mentioned many times, Barbara, that if we get 70 to 85% of the United States population vaccinated over the next several months, And I think if we do it correctly and we make this what it is, a medical emergency to get these people vaccinated, we can get that accomplished by the middle to end of the summer, so that hopefully we'll get back to some form of normality as we get into the fall. But we can turn the curve around well before then. When I talk about 70 to 85% of the population vaccinated, I'm talking about achieving herd immunity where the level of the virus is so low that it is not threatening to people. But in the months before then, as you get more and more people vaccinated, you can dramatically diminish the impact. So to our courageous healthcare providers out there, hang in there, please. We know what you're going through. You're doing a terrific job. As more and more people get vaccinated, there's going to be less stress on the system.
Absolutely. You mentioned vaccines. Obviously, we're so delighted that there are 2 vaccines. And luckily, Dr. Kizzmekia Corbett will be joining us tomorrow to talk about her work on the vaccines. I'm curious, does this seem possible? Are we going to change the way that we're approaching vaccination? I know we're not to the landmark where we'd like to be at this point. And are there any examples of previous vaccination campaigns you're drawing on? I'm lucky to be my age, and I have not experienced an adult vaccination campaign in the United States, but are you drawing on other examples?
Yes. The one that I often mention to people, and only somebody, Barbara, at my age can remember it, but in 1947, an American went on vacation in Mexico and contracted smallpox, did not know that he had it, came back to New York City. 12 people were infected and hospitalized, and 2 died. The New York City health authorities decided to vaccinate the entire city. And literally in 3 weeks, they vaccinated 6,350,000 people, 5 million of which were vaccinated in 2 weeks. One of those 5 million people was a 6-year-old Anthony Fauci when I was a child at that time. So it can be done. I think people need to appreciate that we need to do better than we've done so far, but without making excuses, because there is no excuse, we should have done better, that this was the initiation of almost an unprecedented effort, similar to what we had to do in New York City with the smallpox challenge in 1947. And also it was initiated right in the middle of a holiday season. And the other thing that we're realizing now, we learn as we go along, that the idea of trying to get priority groups, which were appropriate as recommended by the CDC and the Advisory Committee on Immunization Practices, getting healthcare providers and getting people who are in nursing homes and the staff that takes care of them, then going on to the elderly, that we were a bit too rigid in categorizing and classifying people so that we were not getting the vaccine doses out in the most efficient manner. That's changed. Right now, we're not going to abandon the prioritization, but when people are ready to get vaccinated, we're going to move right on to the next level so that there are not vaccine doses that are sitting in a freezer or a refrigerator where they could be getting into people's arms. So I think what you're going to see, Barbara, in the next few weeks, in the next week or two, a month on, we're going to be seeing much more efficient administration of the vaccine, namely getting it into people's arms.
Mm-hmm. Great. I'm looking forward to that. We have news of new COVID-19 variants, and we're learning more every day. I'm curious how you see the new variant affecting the next stage of the pandemic, and what do you think people need to know?
Well, first of all, the big picture, if you go to 40,000 feet, that these coronaviruses are RNA viruses, and RNA viruses have a tendency to mutate a fair amount when they replicate. The more they replicate, the more people get infected, the more opportunities they have to mutate. Since we have such a massive amount of infections throughout the world, particularly in the United States, you're going to see mutations. We know from our colleagues in the UK that they have a mutation or series of mutations which they've been following that's associated with an increase in transmissibility. Namely, it makes it more infectious. What they have looked at and told us that it does not make the virus more virulent. In other words, it doesn't make on a person-to-person basis someone more sick or more likely to die. And at this point, it does not appear to have any negative impact on the protection afforded by the vaccine. There's a big but to that, Barbara, and the but is we need to look at this ourselves. So we are very intensively looking at the UK variant, which is now spread through many countries throughout the world, but there's also an even more disturbing set of variants in South Africa, again, that we are looking at very carefully. And in speaking in preliminary data to my colleagues in South Africa, there's more of a threat there that would evade some of the monoclonal antibodies that are around. So it could be having some impact on protection for the monoclonal antibodies and perhaps even for the vaccine. We don't know that. At this point, from what we're seeing, the mutant, which is not prevalent in our country, it's here, but it's not prevalent, does not seem to have any negative impact. We are very intensively following that, Barbara, because we take these things very seriously. People ask me, are you worried about it? These are not the kind of things I worry about, but it's the kind of things that I take very seriously. And we have our team here at NIH and many of our grantees, namely people out in the academic institutions, studying this very intensively.
Mm-hmm. Great. I feel great that you're not worried about this. On a different note, in the research that we debuted this morning, unsurprisingly, it pointed out that a country's pre-existing conditions are exacerbated in pandemics. And of course, we're seeing this in the United States. We see that Black, Latinx, and Native American populations are disproportionately impacted by COVID, which really speaks to our pre-existing condition of racism and systemic racism. And I'm wondering how you think about addressing these wrongs to make sure that we can deal with COVID, but also more important, or equally as importantly, to make sure we're prepared for the next pandemic.
Well, the disparities of underlying conditions, as well as the likelihood that you'll get infected, I refer to it in sort of colloquial language as a double negative whammy against brown and Black people. First of all, they are in positions in the sense of the jobs that many of them have where they don't have the opportunity to be behind a computer and doing things virtually. They're out there in the community with jobs that put them into contact with people, thereby making them at a higher risk. So they're higher risk for infection. But as important, if not more important, is the fact that the underlying conditions that they have, diabetes, obesity, heart disease, hypertension, kidney disease, chronic lung disease, makes them more likely to get a serious outcome from COVID-19 disease. What we can do is to get resources now to them, to get them tested so they can get into proper care quickly if they need the proper care. But also, to me, it shines a very bright light on a failing in our society that is going back decades and decades and decades. And that is the social determinants of health that minorities have to face literally from the time they're born. So we're not going to change that within the context of this outbreak, Barbara, but we really need to make this be really a stimulus for us to take seriously how do we address these social determinants of health, because it's a multi-decade commitment. It's not something that you could change overnight, because just like with HIV, the disproportionate number of minorities who get infected with HIV in our country, we're seeing the same thing with COVID-19. It's very painful. How many more of these do we have to see before we make a national commitment to do something about this? And I hope if there's anything that comes out of this in a true lessons learned with an agenda to change it, it's taking a look at how to ameliorate these social determinants of health.
Absolutely. That reminds me of another big factor that came out of the research this morning, which is solidarity, how important it is, within your own country and within people that are disproportionately impacted. And then also from a global standpoint, obviously, COVID doesn't seem to care about borders. I'm curious how you think about solidarity and how the United States can be embodying solidarity to move forward.
Well, I'm glad you asked that question, and I'm disturbed at how I'm going to have to answer it, Barbara, because you're absolutely right. When you're dealing with a pandemic, that it's an infectious disease that doesn't know the difference between you and me, or me here in Washington and you in New York, or wherever you are, or in California, or in Washington State. Infectious diseases don't know any boundaries. And when you're involved in an infectious disease that's a global pandemic, everybody has to pull together within a nation and pull together as part of the global community. And the reason I said it's somewhat painful to answer the question is because if ever there was an example of the lack of solidarity in this particular outbreak within our own country, which has been so divided that public health issues have taken on a political context, that's the worst possible thing one can do if you want to adequately address a pandemic that involves virtually everybody in the country, either directly or indirectly. So we've got to get back and recapture that spirit of solidarity, not only within our country, but how we deal with the rest of the world, which is suffering as much as we are.
Absolutely. We actually have a question from an audience member. His name is Ancito Etienne. I believe he's going to join us on screen right now. He has a question about solidarity and vaccines. Hi, Ancito.
Hi, Barbara. Good afternoon, Dr. Fauci. Thank you so much for joining us this afternoon. My name is Ancito Etienne. I am from Haiti. I am currently a master's degree candidate in public policy at the Harvard Kennedy School. I am also a trustee of Partners in Health. My question is about the COVID-19 vaccine. While we roll out the COVID-19 vaccine, we know that we cannot stop COVID in the US unless we stop it everywhere. Yet the vaccine supply is scarce. Only a handful of companies are producing the vaccines, and they are rolling them out far slower than COVID is spreading, despite our best efforts. We urgently need more manufacturers to be making vaccine, most particularly in middle and low-income countries. My question is, would you encourage the United States to join the World Health Organization's COVID technology access pool for COVID-19 technology so that NIH-funded COVID technology and know-how can be shared with the world to increase production and drive a quicker response to this pandemic?
So that's an easy answer. Yes, yes, yes. I think that, and I've said this, Barbara will relate to this because this is what I said and was told to me by Barbara's dad, George W. Bush, back in 2002, when we decided we were going to put together the President's Emergency Plan for AIDS Relief, so PEPFAR, which we as a nation that's a rich nation have a moral responsibility not to let those in other parts of the world that are not as fortunate as us suffer disproportionately because of lack of resources. So I fully believe that whether it's HIV, AIDS, or whether it's COVID, we are part of the global community. We are a rich country. We have to participate in the kind of solidarity that Barbara just asked me about and join forces with the rest of the nations to make sure that billions and billions of doses are manufactured so that the poorest country can get the same sort of access to vaccines as we do in Washington and in New York City.
Thank you for the insight, and thank you for your tireless work during this crisis.
Thank you.
So, Dr. Fauci, you obviously are a central figure in the United States and in the world focused on COVID. Trust has been a big issue here, as it has been all around the world. And I'm curious if you've become more mindful of maintaining the public's trust throughout these changing times. Have you thought about trust differently because of this pandemic?
Yes, this has been a most unusual experience. You know, after you've done this, like I have, Barbara, for almost 40 years, you think you've seen everything. But this is a new experience. And it is when you're trying to deal with something that requires pulling together, you have such a degree of divisiveness in the country that it is difficult to establish trust when the people are pushing back on what you're trying to say with a degree of vehemence about it that just goes over and above beyond the pale of disagreeing intellectually with something. It's like facts don't make any difference. It's you versus us, or us versus you. And that to me is something that we have got to, as a nation, try to come together. You know, I think anyone who saw the horrifying events of the past week, last week in Washington, D.C., are going to realize that this is not going to be an easy task. But the one thing we can't do, we can't throw up our hands and say it's a hopeless situation. We've got to address it. We've got to bring our differences together again. Otherwise, we're never going to be able to adequately fight this or the next pandemic. You know, so maybe the appreciation of why it's so important to pull together will get people to take a deep breath and put aside those differences that have become so strident. I hope so. I've never seen anything like this before, and it's really quite disturbing.
Mm-hmm. Agreed. Speaking more to trust, we have this incredible tool, which is the vaccine, but it doesn't matter if people aren't willing to take it. And I know you've been public about addressing vaccine hesitancy and distrust. You got vaccinated for the world to see. Does the federal government have a plan to address vaccine hesitancy? Oh, yes. We're doing an incredible amount. Many of us, not just myself. I mean, I can tell you, Barbara, without hyperbole, that I spend at least half of my day, be it on Zoom talks with groups, African-American church groups, Congressional Black Caucus, Instagram lives, Facebook lives, talking about the importance of people getting vaccinated and trying to address those issues which lead to vaccine hesitancy and skepticism. And we're putting out a number of papers, of speeches. It's something that we're taking very seriously. It's not easy to turn around because some of the skepticism historically, particularly among minority populations, is founded in bad things that happened decades ago. So we've got to overcome that and reset the clock and talk about how vaccines are so important, not only for individual health, the health of one's family, as well as the health of the nation. Absolutely. Of course, we see that right now. So much of the hesitancy is rooted in marginalization or exploitation previously. And it sounds like something that you're doing in your conversations with people is demonstrating trustworthiness, which is so important. We talk a lot about communications right now, but I think something that's most important is modeling that you're trustworthy. And it seems like you're doing that in the way that you lead right now. Well, yes, I try to do that. I think what we do need, because we have, you have to admit it, we've had mixed messages coming out from higher levels of government right now. And that is really unfortunate because that does get people confused. And when you have mixed messages, people who have their own agenda can always find one of those messages that agree with them. Whereas if you have a consistent message and someone doesn't agree with them, you could convince them and say, well, wait a minute. The people who really are in the know and are working on this every day seem to think about it this way. Let me try to at least consider that. But when you have multiple mixed messages all over the place, it's totally confusing to a person who has an open mind, and it gives easy avenue for somebody to go down the road of saying, no, you're wrong, my way is right. And that is just something that you can't have when the necessity exists to pull together in a uniform way. So you're absolutely right. Trustworthiness, consistent messaging is extremely important. Great. Thank you, Dr. Fauci. we are at time, but I know one thing that I hope is a silver lining out of this pandemic. There's many, but I hope one is what's been called the Fauci effect, the fact that medical school applications have been rising across the United States and around the world after seeing such incredible high-profile leaders like you. So thank you for everything you're doing every day to address COVID. And thank you for hopefully the groundwork that your example is laying for future preparedness. We're so grateful you were with us.
Thank you, Barbara. As always, it's a great pleasure to be with you. Thanks an awful lot.
Thank you.